So next I'd like to introduce Dudley Benoit from JP Morgan Chase, which is our lead banking partner. Dudley is the Senior Vice President of Intermediary Lending. And Dudley, in response to your email, yes, we're buttering you up because we will be asking for more.
Thank you for the introduction. And Kathleen, you should know when I go, back to the airport as I wait for my flight, I'm going to go start my imdb.com page. So this is going to be the first credit. Good evening, and I can't express how happy I am here to be with you all and for us to be taking part in this innovative and kind of groundbreaking partnership. So we're very thankful for being included. I manage, as was discussed, I manage all of our lending to CDFIs nationally, and with groups such as NCB Capital Impact, which is one of our strongest partners, and we work with them on several fronts, and I'm sure Scott and Annie and some other folks will have more ideas for us to fund, and we look forward to doing that. I like being at Chase. I have some of my colleagues here, and we love our firm because, we're the leader in providing financing to individuals, businesses, governments, but today I'm most proud because we're the lead lender here today in this California FreshWorks Fund. The efforts of Tina and Scott and others has been tremendous in helping us get to this place in a remarkably short amount of time. I don't think people understand how long these things usually take to get together, but we've gotten there quickly. And I'm going to go off script because I want to thank Sarah Schulte right there. Stand up, Sarah. Stand up. Come on. Time's a wasting. She's been doing a lot of the legwork, and Sean Larson sitting next to her, he's been really helping out as well. So those are, I'm up here talking, but they're really doing the hard work, and I'm in the pits and making this happen, so thank you. We can't express, again, enough how happy we are to be partnering with the California Endowment, Unified Grocers, NCB Capital Impact in this initiative, because it's really a core piece of what we do, and personally, it's a core piece of what I do. I have a passion for these communities. I am a product of these communities. You can even say I'm really a product of these communities. My family's from Sarafala, Haiti. That's Haiti for those that don't speak Creole. So these communities and the things we do and how we improve them are not just a job for me. It's not necessarily a vocation, but it's the way I live my life. So we're really happy to be working with you and doing this here. We're happy in building communities. We're helping and happy about helping businesses start. And because of that, we've committed $30 million into this fund, and we've also committed $2.5 million of grant dollars into this fund. And those of you in this world know the grant dollars are not easy to come by, but because of Antonio Manning sitting here that runs our foundation in California and all of our colleagues in corporate philanthropy were able to do that. So I just want to end by saying thank you, thank you, and thank you, and we look forward to doing more work with you.
Thank you, Dudley. So we are so grateful for all of our banking partners. And next I'd like to introduce Janet Lamkin, the president of Bank of America California, another critical partner for the California Endowment, not only in terms of the FreshWorks Fund, but also in terms of the work that we're going to be doing together around building healthy communities. So we're very pleased to have you join us this evening. Thank you.
Thank you, Tina. Thank you so much. It's such a pleasure to be here tonight, and what an exciting night. As Tina mentioned, we work with the endowment on a number of great projects, and this is one of the most exciting ones. And I want to just begin by recognizing a colleague of mine who I think is here, Danielle Campos. If Danielle is here, there she is, who has just done, please, a wonderful job making this happen. We could not be more excited about this wonderful array of partners, many of whom we have worked with individually, and to bring this group together is really quite unique and wonderful. We've been very involved in the issue of food insecurity for some time because we think it's one of the most fundamental issues challenging our communities. And as we work to find solutions on a number of issues, workforce development, housing, food insecurity, it really all comes together that you have to solve each of those components. For us, we think this is a game changer. We are so excited about this. We think this is going to be the start of something really wonderful in this market, which is our biggest market. We are completely committed to this community and this great partnership. So we're just here with great excitement tonight. And thanks to all these partners, and Tina particularly. It really is all in the family because Tina's mother works with us. So thanks so much to Tina for her great insight and great dedication.
All right, so we've heard from some of our banking partners, we've heard from some of our industry partners, and now I have the pleasure of introducing Dr. Amy Porter from Kaiser Permanente, who's going to give us a little bit of the health perspective, which is really what this is all about at the end of the day.
Thank Thank you. I do have, I think, a different perspective. I am a full-time working pediatrician. It's what I do for a living. This kind of work I do because I kind of have a passion for it, but the reason I do is because when I did my training, which really wasn't that long ago, it was in the early 90s, about 20 years ago, some of the things we didn't really learn as pediatricians, we didn't take care of people with type 2 diabetes, which at that time was actually called adult onset diabetes because, well, happened to adults. We didn't have patients with primary hypertension. We didn't have gallbladder disease. We didn't have to worry about sleep apnea. These are the kind of things that right now, 20 years later, 15, 20 years later, there isn't a pediatrician out there that doesn't have kids with these problems. And I'm lucky enough to work for Kaiser, and Kaiser has such a strong understanding that, as has been said, prevention is the most important way to deal with this epidemic. It's the only way. Because let me tell you, trying to treat sleep apnea in a 9-year-old is miserable. So we really have to be, ahead of this. And I do want to give a shout out to the community benefit people because they are so strong and so helpful. And for people like me who are trained as docs and really don't understand a lot, don't get a lot of training in community work, they have really helped me to see these kind of things that are going on, and it's been so exciting. And yesterday I was at the White House, and I met Michelle Obama, and that's kind of really cool. I think that's really cool. So it's just wonderful for me, and I'm so happy that Kaiser is part of this partnership because to see all these different groups and kind of groups that I didn't know I would ever be involved with as a doc. And in my mind, the only way to really change this is to change the culture. And I think we're at that point where everything's going to be changing. And I think in the perfect world that I see, one day the parents of my patients, when they go to look for where they want to live and where they want their children to be raised, they're not just going to say, well, how big are the houses and how are the schools there? But they're going to say, well, what are the community services like? What are the grocery stores like? Do you guys have farmers markets every week, or is it every other week? Because I want the every week one. And I think that's really going to change everything. And I think we're there. We're at a place, and that's why it's so wonderful that Michelle Obama is involved. I mean, the First Lady is excited about this. So I am obviously very excited, and we're very, very happy to be a part of this. And I just want to thank everyone for all the hard work that everyone has done. Thanks.